Are you someone who's had a rhinoplasty, but it's not gone well? You're not happy with the result and you want to get it fixed, but you're worried, will the second surgery do the job? When one surgery didn't work, why should the second one work? I'm Dr. Venkat Center, plastic surgeon at the Venkat Center, Bangalore. Today, we will talk all about secondary rhinoplasty. To begin, what is a secondary rhinoplasty? A secondary rhinoplasty is a rhinoplasty done in someone who's already had a rhinoplasty before. So, one surgery has been done, the patient is not happy with the result, and that's why we do a second surgery to correct it. That's why it's called a secondary rhinoplasty. Now, why would a secondary rhinoplasty be done? Why would it be needed? So, obviously, as I mentioned, the simple thing is that the patient's not happy with the result of the primary rhinoplasty, and so we're getting it done. But what exactly does this mean? I like to think of secondary rhinoplasty cases as basically being in three categories. The first one is where in the primary rhinoplasty, the surgeon had no idea what he was doing and it's completely a botched nose. The result is really bad, and forget making things better, the nose has gotten worse than what it was before the first surgery. This kind of patient clearly needs a corrective surgery. The second group of patients are where the first surgeon did his best, but things go wrong. Things can go wrong in any surgery. There might have been a complication such as an infection. So the result isn't as good as what the patient wanted. This is where, again, you might require a secondary surgery to improve things. And thirdly, a patient might be unhappy, but the result might actually not be bad. Many times a patient might not really know what they're looking for, and so you do the rhinoplasty and it comes out well, but the patient is not happy. This group of patients never should have had a primary rhinoplasty in the first place. A rhinoplasty or any cosmetic surgery is a mental surgery as well as physical surgery. The patient should be in the right frame of mind to undergo this surgery because it is changing their experience. So, this group of patients, we really need to see and judge whether a secondary rhinoplasty is worth it or not. What do I mean by worth it? Let us see next. Now, a secondary rhinoplasty is much more challenging than a primary rhinoplasty. It is much more difficult than a primary rhinoplasty. Why is this? There are three main reasons. Firstly, the nose will have been scarred from the first surgery. In the primary rhinoplasty, you can open everything nicely, everything opens up beautifully. In the secondary rhinoplasty, everything is stuck together, there is scar tissue. So, opening this is more challenging, and that is one of the challenges. The second challenge is you might not have all the resources you need. Things might have been used up in the first surgery that you can no longer use in the second surgery. The most common example for this is, for all rhinoplasties, we need something called cartilage to do our cosmetic changes. Cartilage is this firm material that you feel here. On top is the bone, the firm thing below the bone is the cartilage. So the most common place we take cartilage from is from the center of the nose, what is known as the septum. In most rhinoplasties, we take the cartilage from the septum, so the whole surgery is done inside the nose itself. But if in a primary rhinoplasty the septum has already been used, then we can't use it again. It's not there. So we need to get cartilage from elsewhere. So that usually involves taking it from the ear or from the rib. So we're going to another area, everything cannot be done in the nose. This makes the surgery a bigger surgery. Thirdly, you can never be entirely sure what you're going to find inside the nose when you open it. In many cases, the first surgery might not have been documented well. Yes, there are things we do before surgery, such as examining the patient and maybe getting a CT scan, which will give us some idea, but you always have to be prepared for surprises. And finally, the last challenge is the patient's in a different mental state compared to the first surgery. In the first surgery, you're going in with hope, you're going in with excitement that you're going to get the nose you want. In a secondary rhinoplasty, you're going in with a little bit of apprehension, you're going in with a little bit of fear that my first surgery didn't go out well. How will the second surgery turn out? These are all the reasons why a secondary rhinoplasty is more challenging than a primary rhinoplasty. So, how can we get a secondary rhinoplasty right? What can we do to make sure that a secondary rhinoplasty, you will have a good result? Well, this depends on two main things. Obviously, the patient and the doctor. The patient should be in a right frame of mind. You need to talk to the patient, counsel the patient, and make the patient understand that in secondary rhinoplasty, your first and biggest aim is to make sure that this is the last surgery they have, that you are not putting the patient in the position where a third surgery might be required. That is our biggest aim. So what this means is we need to be more careful. With each surgery, the strength of the nose goes down. So with one rhinoplasty, the nose is a little weaker. With the second rhinoplasty, it will be even weaker. So it's not just about cosmetic corrections, it's also about making sure the nose retains its strength. So for this reason, you cannot do everything. You cannot be as aggressive as you would in a primary rhinoplasty. You have to make sure that whatever result you give is long lasting. So you need to talk to the patient, examine the patient, and see what is achievable, what is not achievable. In a primary rhinoplasty, you're trying to go from here to here. In a secondary rhinoplasty, you're not starting from here, you're starting from here. So you have to first bring it to normal and then try to improve it as much as possible. The patient needs to understand this. Secondly, the doctor should be well versed in rhinoplasty. Secondary rhinoplasty is not something to be attempted by someone just starting out who doesn't have too much rhinoplasty experience. It is among one of the most toughest surgeries there is. So make sure you find a doctor who has done secondary rhinoplasties who can satisfy your needs. When can a secondary rhinoplasty be done? You cannot rush into a secondary rhinoplasty soon after a primary rhinoplasty. The nose needs to heal from the first surgery. Usually, we wait for at least a year after the first surgery before attempting a second surgery. In some cases, it can be a little bit shorter, but on average, waiting a year is good because then the nose has healed fully, everything has softened up, and that makes the surgery easier. Secondly, the healing process takes a year. So you don't know exactly what you're trying to correct because the nose hasn't revealed its full shape yet. So you need to let the nose reveal its full shape from the first surgery so that you know exactly what you're trying to do in the second surgery. For this reason, we usually advise waiting for a full year after the first surgery. Now, let us look at some examples of secondary rhinoplasty to see how we were able to give a good result in these patients. So here we'll see some examples of secondary rhinoplasties. One thing I want to make it clear is that no two secondary surgeries are the same. In primary surgeries, you can find noses that are similar where you can do similar things. But in secondary surgeries, things are very different. Each case is unique. It's not just about what's on the outside, it's about the techniques that are used on the inside. So therefore, every case is unique and it's difficult to relate one case to another. So here we see a patient after first surgery, the nose was very, very twisted. This happens when you're not given the strength of the nose and it has gotten weakened. So for this reason, we have to give back the strength of the nose, and that means giving strong support to the center of the nose to give a straighter nose. So you see here, it is straighter, it looks nicer, but it's a little wider than before. That is what I mean by when I say that a secondary rhinoplasty, you can't do everything. If this was as thin as before, it was just bent and twisted. Now, in this patient, after the first surgery, there was quite a large hump. So we had to remove that hump and make the dorsum straight. And you saw from the front, there was a bit of a curve. The tip was going to the right. So that had to be straightened as well. Here's another patient where after the first surgery, the nose had collapsed because there was no strength. So here you can see what is called a saddle nose. So the strength of the nose had gone. So we had to add rib cartilage to build back the strength and give a good height to the nose. And from the front view, everything was flat. There were no nice lines. The tip was falling down. So we again used the cartilage to give nice lines. This is around 2 weeks after surgery, and this gets better as the swelling goes down. And here is one example where the result of the first surgery was quite bad. The patient was very depressed and distressed. We can see that the nose is really, really twisted. The nostrils are completely asymmetric. There is a very large hump which was not there before. He got a hump after surgery, and the tip has completely raised up. You can see from the front it's almost a pig nose. This much nostril should not be seen. So this patient was very stressed and very depressed, and thankfully we were able to help him out. So after the surgery, you can see that the nostrils have come down and they are more natural, and the deviation is gone, it is straight. From the side view, that large hump has gone and now it is a straight dorsum. The tip, which is so high, has come down, and that notching in the nostril has all improved. So here you can see that none of these cases are the same. No two cases are the same. Every secondary rhinoplasty is a challenge because each patient is different and the treatment has to be different. I hope this was informational for you. One last thing that I would like to say is the best way to do a secondary rhinoplasty is to avoid it completely. What do I mean by that? I mean getting it right the first time. Make sure the first rhinoplasty has the maximum chance of success. For this, make sure you get your surgery done by someone who is trained in rhinoplasty. Ask for their qualifications, ask to see the results, and make your decision. Do not rush into someone who is just might be the cheapest around. That should not be the way that you approach a rhinoplasty. It is one of the most complicated surgeries there is, and finding a good rhinoplasty surgeon is not easy. So do your homework, get it right the first time, and that way you can avoid having a second surgery done. If you like this video, do share it, do subscribe to our channel, click the bell icon for notifications. Let us know in the comments about any other videos you would like to see. Thank you. Have a great day.